Phlebotomy exam practice test. Question 1. The term phlebotomy comes from Greek words that mean draw blood, cut vein, drain blood, dermal cut. Phlebotomy comes from Greek phlebos, vein, and tome, incision or cut, literally meaning to cut into a vein for blood collection. Question 2. The minimum requirements for entry into a phlebotomy training program generally include a nursing degree or CNA certification, medical laboratory (MLT) certification, high school diploma or equivalent, medical assisting certification. Most phlebotomy training programs require only a high school diploma or equivalent as the minimum entry requirement, not prior healthcare certification. Question 3. The main duty of a phlebotomist is to interpret laboratory values, evaluate blood specimens, process blood specimens, collect blood specimens. The primary duty of a phlebotomist is to collect blood specimens from patients for laboratory testing, not interpretation or processing. Question 4. The phlebotomist is mainly responsible for which phase of laboratory testing? Examination, pre-examination, post-examination, reporting. Phlebotomists work primarily in the pre-examination, pre-analytical phase, which includes patient preparation, specimen collection, handling, and transport. Question 5. Which of the following is not a phlebotomist's duty? Aseptic procedures, dermal or capillary puncture, surgery assistance, venipuncture. Surgery assistance falls outside the scope of phlebotomy practice. Phlebotomists perform venipuncture, capillary puncture, and aseptic procedures for blood collection. Question 6. Which is the fastest growing type of facility that provides job opportunities for phlebotomists? Physician offices, home health care, insurance companies, ambulatory care centers. Ambulatory care centers, urgent care, outpatient clinics, are rapidly growing and increasingly employ phlebotomists for outpatient blood collection services. Question 7. The diagnosis and treatment of conditions pertaining to the heart and circulatory system are the functions of which medical specialty? Anesthesiology, cardiology, respiratory therapy, electroencephalography. Cardiology is the medical specialty focused on diagnosing and treating heart and circulatory system disorders, including coronary artery disease and heart failure. Question 8. The assessment and treatment of breathing disorders are the functions of which medical specialty? Diagnostic imaging, endocrinology, physical therapy, respiratory care. Respiratory care, respiratory therapy, specializes in assessing and treating breathing disorders such as asthma, COPD, and pneumonia. Question 9. Restoration of maximum movement and functional ability is the purpose of occupational therapy, orthopedics, physical therapy, respiratory therapy. Physical therapy focuses on restoring movement, strength, and functional ability through exercises, manual therapy, and patient education. Question 10. Which specialty uses ionizing radiation to produce diagnostic images? Nuclear medicine, orthopedics, pathology, surgery. Nuclear medicine uses small amounts of radioactive materials, ionizing radiation, to create diagnostic images of organ function and structure. Question 11. Which specialty recommends treatment plans based on therapeutic drug monitoring results from the laboratory? Nuclear medicine, pharmacy, radiology, surgery. Pharmacists use therapeutic drug monitoring results from the laboratory to adjust medication dosages and recommend treatment plans for optimal efficacy and safety. Question 12. Surgically removed body tissues are prepared and stained by cytologists, hematologists, histologists, tissue specialists. Histologists prepare and stain surgically removed tissue sections for microscopic examination by pathologists. Question 13. Prepared body tissues are examined and a diagnosis is made by cytologists, histologists, pathologists, tissue specialists. Pathologists are physicians who examine prepared tissue specimens under a microscope to diagnose diseases such as cancer and inflammatory conditions. Question 14. Cross-matching of donated blood with a recipient is the function of cytology, histology, immunohematology, immunology. Immunohematology, blood banking, is responsible for blood typing and cross-matching to ensure compatibility between donated blood and transfusion recipients. Question 15. The study of the body's resistance to disease is the function of clinical chemistry, histology, immunology, microbiology. Immunology studies the immune system and the body's resistance to disease, including immune responses to pathogens, vaccines, and autoimmune disorders. Question 16. CLIA classifies laboratories based on number of employees, size of the laboratory, number of tests performed, complexity of tests performed. CLIA, Clinical Laboratory Improvement Amendments, categorizes laboratories by test complexity, waived, moderate complexity, and high complexity. Question 17. A college dean who wants to offer a phlebotomy training program would seek approval from which organization that sets standards for phlebotomy training programs? CAP, CLSI, NACOS, OSHA. NAACLS, National Accrediting Agency for Clinical Laboratory Sciences, accredits phlebotomy training programs and sets educational standards. Question 18. Barriers that can interfere with clear communication include all of these except eye contact, fear and anxiety, pain or discomfort, television viewing. Eye contact facilitates clear communication by showing engagement and attentiveness. Fear, pain, and distractions like television are communication barriers. Question 19. Customer service would least likely include common courtesy, complexity, flexibility, professionalism. Customer service focuses on simplicity, courtesy, flexibility, and professionalism. Complexity adds confusion and frustration, reducing satisfaction. Question 20. Which scenario would best contribute to customer satisfaction? Receptionist tells patient to have a seat without eye contact. Phlebotomist rushes through a collection procedure. Healthcare worker assists a lost visitor to their destination. Medical assistant wears latest fashions and jewelry. Assisting a lost visitor demonstrates empathy, helpfulness, and professionalism, which directly enhances customer satisfaction and patient experience. Question 21. Which of the following is not a phlebotomist's duty? Labeling collected specimens. Transporting specimens to the lab. Prescribing blood thinners. Verifying patient identity. Prescribing medications, including blood thinners, is outside the phlebotomist's scope of practice and requires a licensed prescriber such as a physician or nurse practitioner. Question 22. Which organization regulates workplace safety for phlebotomists, including needle stick prevention? CLSI, NACOS, OSHA, CAP. OSHA, Occupational Safety and Health Administration, sets and enforces workplace safety standards, including the blood-borne pathogens standard and needle stick prevention. Question 23. The term venipuncture refers to puncturing an artery, puncturing a vein, puncturing the skin for capillary blood, puncturing the bone marrow. Venipuncture specifically means puncturing a vein with a needle to collect blood, from Latin vena, vein, and punctura, piercing. Question 24. Which of the following is an example of a waived test under CLIA? Blood culture, glucose finger stick, point/INR, complete blood count. Waived tests are simple with low risk of error. Glucose finger stick testing is CLIA waived, while blood cultures, PT/INR, and CBC are moderate or high complexity. Question 25. The primary purpose of standard precautions in phlebotomy is to protect the patient only, protect the phlebotomist only, protect both the phlebotomist and patient, speed up the collection process. Standard precautions treat all blood and body fluids as potentially infectious, protecting both healthcare workers and patients from pathogen transmission.